Hello everyone, I'm Dr. Lim Sheow Lei, Senior Medical Oncologist from OncoCare Cancer Centre, Singapore. Today I'm going to talk about cervix cancer. Cervical cancer is cancer that begins in the cervix. The cervix is situated at the lower part of the womb, or what we call the neck of the womb. In Southeast Asia, cervix cancer is in fact very common. It is the second most common cancer affecting women in this part of the world. In countries where there's a higher uptake of pap smear screening, the incidence of cervical cancer is in fact falling. In Singapore, it is now the 10th most common cancer affecting women in Singapore. In the early stages, cervical cancer may not cause any symptoms, but as the cancer grows, it may cause symptoms such as vaginal bleeding. This could be bleeding in between periods, during intercourse, or in women who are already menopausal. Women may also notice some vaginal discharge that may be bloody or foul smelling. There could be also complaints of lower abdominal or pelvic pain or pain during sexual intercourse. In advanced stage cancers, women may notice back pain or experience unexplained tiredness or weight loss. If a doctor suspects cervical cancer, he or she may need to have a clearer view of the cervix. This usually involves a pelvic examination and very often colposcopy examination. A colposcope is a magnifying instrument that allows the doctor to have a clear view of the cervix, and any abnormal areas can be biopsied. This will be sent off to the laboratory to check if this is indeed cancer. If cervical cancer is confirmed, the doctor will order more scans to check if the cancer has spread. This usually involves an MRI scan of the pelvis to check if the cancer has spread to the surrounding organs. A body scan with a CT or a PET CT will be able to tell us if the cancer has spread to other parts of the body. When trying to decide on the best treatment strategies, there are a few factors that the doctor needs to take into account. Number 1, the type of cervical cancer. Number 2, the stage of the cancer. Number 3, whether the woman still wants to have children. And number 4, whether the woman is fit enough to undergo the treatment that we plan for her. There are two main subtypes of cervical cancer, the squamous cell carcinoma and the adenocarcinomas. Both of these cancers are treated in a very similar fashion. There are also rarer subtypes of cervical cancer, such as the neuroendocrine small cell cancer. These type of cancer are treated differently from the squamous cell and the adenocarcinoma. So for the rest of this talk, I'm going to focus on the most common type of cervical cancer, which is the squamous cell and the adenocarcinomas. We group cervical cancers into 3 broad groups for treatment purposes: the early cancers, the locally advanced cancers, and the advanced cancers. Early cervical cancer is cancer that's still confined to the cervix at the time of diagnosis. This type of cancer is treated with surgery, whereby the womb, the cervix, and very often the ovaries and fallopian tubes are removed. Early stage cervical cancer is highly curable, with cure rates exceeding 90%. However, the treatment does render women infertile because of the removal of the womb and the ovaries. 10% of women diagnosed with cervical cancer are below the age of 35. In Singapore, there's a growing trend of women having children later in their life, and therefore we're seeing more and more women diagnosed with cervical cancer who have not completed their family. For cervical cancer that's very early, it may be possible to treat with just a cone biopsy, whereby a cone of tissue around the cervical cancer is removed. Trachelectomy may also be an option. This involves the removal of parts or all of the cervix together with the top part of the vagina. In both of these surgical procedures, the uterus and the ovaries are not removed, so women can still retain their fertility. Locally advanced cervical cancers are cancers that have already spread to the surrounding organs. And this type of cancer we treat with a combination of radiation as well as chemotherapy. Radiation treatment uses high-dose X-rays to target and kill cancer cells. This type of treatment is carefully planned so as to do as little harm as possible to healthy tissues. The treatment takes 6 weeks to complete. Giving chemotherapy at the same time as radiation makes the radiation work better against the cancer. The chemotherapy is administered once a week over the 6-week period. As this is low-dose chemotherapy, it is therefore well tolerated and does not cause hair loss. When cancers have spread to distant organs such as the lungs, the liver, or bones, surgery at this point is pointless. The mainstay treatment is drug treatment to try to control the cancer. Traditionally, chemotherapy is the most common drug treatment used in the treatment of cervical cancer. However, in recent years, there are now newer treatment options such as targeted drug therapy and more recently immunotherapy. These drug treatments are infusional treatments which can be given in outpatient clinic. There is no need for overnight stay in a hospital for such treatments. Many women are concerned about losing their hair during treatment. Targeted therapy and the immunotherapy drugs do not cause hair loss. Some chemotherapy drugs do cause hair loss, and women who are concerned about losing their hair may wish to consider scalp cooling with a cold cap to minimize hair loss during treatment. Chemotherapy are drugs that we use to kill cancer cells. Women are understandably very fearful of chemotherapy because of the perceived side effects. There are many different types of chemotherapy drugs that we can use in the treatment of different cancers, with all with very variable side effects. The side effects of the chemotherapy drugs used in the treatment of cervical cancer are mostly manageable and temporary. Targeted therapy are drugs that switch off the cancer growth by blocking molecules that make cancer grow. Therefore, this type of drug tends to be more precise in its action compared to chemotherapy and causes less side effects. Cancer needs nutrients for its growth. Anti-angiogenics are drugs that disrupts the blood vessel that supply nutrients to the cancer cell, thereby causing cancer death through starvation. There are now drugs available that prevents the binding of the PD-L1 to the PD-1. In so doing, it actually prevents the cancer cell from going into hiding and exposes it to the immune system, making the immune system able to recognize it and kill it. This class of drug is called immune checkpoint inhibitors. What is particularly exciting about this form of cancer treatment is that in some women with advanced cancer treated with immune checkpoint inhibitor, their cancer can be controlled for long periods of time, up to many months or even years. When detected in early stages and with appropriate treatments, the chance of curing cervical cancer exceeds 90%. If unfortunately cancer has already spread at the time of diagnosis, please do not give up hope. There have actually been very advances in the treatment of cervical cancer in recent years, and there are many ongoing research that will likely improve the treatment outcomes for women with cervical cancer. I hope this video is helpful. If you have further questions or would like to find out more, please reach out to us via our website or make an appointment to see us.